Welcome to the Aced It podcast, where we turn science into sense. This is season 10, and in this season, we will provide 10 knowledge-packed episodes with the hopes of helping listeners understand what we can all learn from current research on overdose. It's a hard topic to discuss, but critically important information to know. So I am honored that you're with us. I'm Danielle Rudes, your host, and this is Aced It. Stigma and overdoses. The dreadful faulting and pointing fingers, the action that perpetuates harmful attitudes and barriers to addressing any issues. In this case, substance use and overdoses. Individuals who have had firsthand experiences with overdose or struggle with substance use often face discrimination, blame, and social exclusion. We believe that it is especially important to raise awareness and share information about stigma surrounding overdoses to help foster compassion, encourage support systems, and ultimately help break down the barriers we've seen for so long. Several studies have shown that stigma does play some part in overdose among individuals with substance use disorders. In a 2019 study by Latkin and colleagues, they looked specifically at stigma and non-fatal overdose among those who use drugs in Baltimore, Maryland. After interviewing more than 400 individuals from 2009 to 2013, they found that stigma was positively associated with the risk of having a non-fatal overdose, showing a stronger impact than internalized stigma. Additionally, they looked at the settings in which these individuals use drugs and found that using drugs in more public places is associated with greater likelihood of overdose, linking both discrimination and drug use in public places to overdoses. This suggests that understanding how enacted stigma raises overdose risk could improve prevention strategies. Expanding overdose training to diverse public locations and using peer outreach could help reach those who may not otherwise get this education. Likewise, in a 2024 study by Sibley and colleagues, they recruited 2,608 people from rural areas across 10 states who reported using opioids in the past 30 days in order to further examine the relationship between felt stigma and non-fatal overdoses. They found that 6.6% of participants, 173 people, had experienced an overdose in the past month, and that felt stigma was significantly associated with a higher risk of recent non-fatal overdose, even after adjusting for demographics and substance use factors. This relationship held true in additional evaluation, focusing on specific aspects of stigma, such as fear of discrimination and internalized stigma. Both studies make it clear that stigma, whether it is the discrimination people face or the internalized shame they feel, plays a significant role in increasing the risk of non-fatal overdoses. More supportive and understanding approaches could be key in reaching those who need help the most, ensuring they feel valued and empowered to seek the support they need. One way people can become more supportive and understanding is to use compassionate language. The language we use is incredibly important, but most of the time its importance is overlooked. In an article by Zwick and colleagues, they share some of the ways in which stigma affects patients with substance use disorder. Stigma surrounding substance use disorder may have serious negative impacts on treatment outcomes, healthcare, and policies. Language and stigma often go hand in hand. The words we use can either reinforce negative stereotypes or promote understanding and empathy. The way we choose to describe issues can significantly impact how society views them and treats individuals who might be facing those issues. They discuss the importance of person-first language, which emphasizes the importance of recognizing individuals as people before defining them by their condition. Instead of labeling someone as an addict or abuser, person-first language refers to them as person with a substance use disorder. This approach helps to reduce stigma by focusing on prioritizing the individual themselves. In addition to language, being educated and knowledgeable about these topics can make for meaningful change. In a study done by Passman and colleagues, 2024, they looked at how stigma toward naloxone, the opioid reverser drug, affects participation in overdose education. Their findings show that people who perceive a lot of stigma around naloxone tend to have lower knowledge about it and less positive attitudes toward handling opioid overdoses. But this effect also varies by race. For instance, for white participants, their level of knowledge actually plays a role in how stigma influences their attitudes. This suggests that stigma hits differently depending on racial background. The research also found that regardless of race, having more knowledge about opioid overdoses generally leads to better attitudes toward dealing with these problems. This highlights the importance of education, not just traditional training, but also exploring new ways of giving first aid to individuals who might need it. However, the study also uncovers a tricky link between stigma and knowledge, suggesting that stigma might actually hinder how much people learn, which aligns with past research showing stigma can actually affect cognitive performance. So it is clear that we need more targeted approaches to tackle stigma and improve education to better equip everyone in overdose response, as this could help save lives. The impact of stigma on overdose risk is both profound and distressing. As we've seen from these studies, stigma, whether it manifests as social exclusion, discrimination, or internalized shame, significantly heightens the risk of non-fatal overdoses. It is clear that we need to shift our approach from faulting to fostering understanding and compassion. By embracing more empathetic language and providing education in diverse settings, we can make a real difference. Increasing awareness and knowledge about overdose prevention can empower individuals and communities to respond more effectively. It's not just about training more people. It's about changing attitudes and breaking down barriers that prevent those in need from accessing help. If we work together to create more understanding and inclusive approaches, we can help those struggling with substance use feel valued and supported, ultimately fostering a more helpful and compassionate society. Thank you for listening to the Aced It podcast. We love hearing from you, so if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me, Danielle Rudes, at Sam Houston State University. My email is drudes@shsu.edu. And as always, thank you to the Justice Community Opioid Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters, Dr. Chelsea Narvi from Sam Houston State University and SHSU master student Jalen Magana. And a huge and heartfelt thank you to Jason Luchin and the team at Slonky LLC for their wonderful production, as always. Tune in again soon for another episode of Aced It.